happy to highlight the rationale for this ongoing pivotal phase 3 trial, STELLAR-303, combining Zanzalintinib or XL092 in combination with atezolizumab versus regorafenib in patients with microsatellite stable colorectal cancer post progression or intolerance to standard of care chemotherapy. The study is based on the rationale that combining VEGF tyrosine kinase inhibitor plus immunotherapy or targeting the VEGF pathway and PD-L1 or PD-1 pathway is synergistic through modulation of the tumor microenvironment to making it more immune-permissive. So there is preclinical data with the older generation drug that's called Cabozantinib, showing that combining Cabozantinib with checkpoint inhibitors leads to tumor microenvironment modulation. There's data in colorectal cancer as well as in vivo data in other tumor types. This has led to early phase trials combining Cabozantinib with immunotherapy in colorectal cancer. I have led the investigator-initiated CAMILLA trial combining Cabozantinib plus durvalumab in GI malignancies, and the colon cohort of that trial was based or focused on this population, the colorectal cancer population progressing on standard of care chemotherapy. We have seen encouraging results in this population with the combo, with an overall response rate around 28%, and decent, I would say, progression-free time and overall survival. There was a differential outcome seen in patients who have RAS wild-type disease. This was replicated when a post-hoc analysis was done on the COSMIC-012 trial that also combined Cabozantinib plus atezolizumab in the colorectal cancer space. In that study, encouraging results was also seen in the overall population with some differential result or differentially positive outcome seen in the RAS wild-type in that study. So those two kind of studies have led or justified the launch of this phase 3 trial, combining the next generation drug, which is called Zanzalintinib. It is a new generation VEGF MET tyrosine kinase inhibitor that targets multiple tyrosine kinases beside VEGF and MET, and have similar, I would say, target profile, relatively similar target profile to Cabozantinib. And it was engineered to have a lower half-life and better overall toxicity profile. This agent was explored in first-in-human large multi-cohort study. And this early phase trial that looked at this agent as single agent as well as in combination with immunotherapy was presented at the ESMO meeting last year and showed, I would say, favorable safety profile in general in multiple solid tumors. And I would say overall less hand-foot syndrome seen with this agent as opposed to Cabozantinib. And in terms of efficacy, the responses were seen across board in multiple tumor types, including colorectal cancer. So this kind of justified or supported this drug and the launch of this currently ongoing trial. This trial again is a global study, open in the U.S. As well as Europe and Eastern Asia and Australia. We are looking at enrolling around 870 patients to the trial, with the primary endpoint of overall survival in patients who do not have liver metastasis. And the secondary endpoints will look at overall survival in the overall population, so hierarchical endpoints. We will be looking at also progression-free time and the safety profile as secondary endpoints as well. We are collecting blood samples as well for exploratory analysis that could be, for example, focused on post-hoc analysis of the RAS wild-type subgroup and survival data in the subgroup as opposed to the overall population, which could be done based on ctDNA analysis and confirming RAS wild-type status. This is kind of the summary of the overall trial. We're looking forward to present the interim data or report the interim data of the study in a future meeting.